use of economies of scale, centralized wait lists, electronic universal health record keeping, and the use of healthcare teams. We need more and better evidence to guide our decision making. More evidence-based healthcare will reduce variations in practice and outcomes, lead to greater standards of care, and enhance value for money. We have to tackle the shortage of healthcare personnel. Canada is now ranked 30 out of 30 on a ratio of doctors and acute care beds per 1,000 people. Greens also want to enshrine a policy that ensures seniors are cared for where possible in the community. And I want to make a point, Greens stand by universal, accessible, single-payer healthcare. We call for comprehensive approach to mental health, and we also call for free preventive dental care. I'm aware that the list of the priorities may seem overwhelming, but we do need energy, resources, and creative solutions to ensure that our excellent healthcare system remains for every Canadian our right and not a privilege accessed only by the wealthy.
All right, thank you very much. And so, moving along the table.
So we believe that our aging population is actually one of the, if not the major factor going forward in our future with healthcare. And the underfunding of the system has, in a lot of ways, paved the way for the discussion about having user fees or a two-tiered system, which is obviously we are completely opposed to as AVP. Going forward, there's a few things we'd like to see. So we know that when seniors and older people can stay in their own homes, there's a much lower cost for that service. So one thing we'd like to see is people who are renovating their spaces in their homes, that they would get up to 50% back for those renovations so they can stay in their own homes. And if families are renovating their own homes so they can have someone older live with them in a self-contained unit, we'd like to provide up to 200,000 grants for that, up to $35,000 for those spaces. So, families like my grandmother, in fact, she's 93 years old. She's just gone into a long-term care facility. But if some of those things had been in place, then my family could have maybe made some different decisions. But $5,000 is too much for lots of families. Certainly 20, 30, 40, 50 is out of range. So families who are willing and able to take care of their elderly, we have to give them those pieces. Another thing going forward, and hopefully this will be part of the Accord in 2014, is really looking at a community-based, holistic approach to healthcare. Doctors are some of the most expensive people, to provide healthcare, and we know nurses, nurse practitioners, nutritionists, physiotherapists, that those people also need to be trained and work together in teams, whenever possible in a small local environment moving forward. And that's a much cheaper way to provide sort of a more holistic approach to healthcare. And as we're aging, we need to be moving towards innovation. And the sort of first wave of Medicare, as the NDP often call it, is very hospital and doctor focused, which was important. But moving forward, we have to look at a more broad range, because otherwise we're going to hit that point where people are going to say, this is no longer sustainable, we can't afford it, so we have to let the rich pay, because they can, to help take the burden off the system as a whole economically, and that's unacceptable.
Thanks very much. All right.
Thanks very much. I think that the overriding goal and challenge is the confidence that Canadians have in our single-payer system, and that means the sustainability argument that all of us have talked about. We have to, as Liberals, we believe you have to do two things. One is to increase the health of Canadians and help keep them well, and you have to make sure that, and so that's turning down the demand side, and at the same time on the supply side, we have to make sure we're getting value for money, and that we are doing things in a totally sustainable way. On the demand side, that means that we have to take a whole of government approach. That means dealing with poverty, violence, the environment, shelter, equity, education, and wrap that up in the social determinants of health. We then have to deal with the modifiable risks. And government needs to play a role. And that's why we have a national food policy, a policy on physical activity, but also regulation of sodium trans fats. There's a number of things that government really can do to be a true partner in keeping people well. On the healthcare delivery side, it's time the federal government actually stepped up. We're the 5th biggest provider of healthcare with our Aboriginal peoples, our military, our veterans, corrections, RCMP. We've got to lead by example, and that means that we too have to give and provide research for the most appropriate care in the most appropriate place by the most appropriate person, paid and unpaid. We need to make sure that the provinces and territories know there's stable funding, but we also have to work with the provinces and territories to share best practices, share innovation, make sure that the neat models of care that exist all across the country are there and shared with everyone. But we need now, as the CMA has said, to make sure that it's not okay that the postal code determines what kind of care you get. We're a country, and that we need to be working together on high quality care for every Canadian, and that means enough healthcare providers to do it properly.
Thank you very much. All right, so now we'll move on to the response and question asking part of it. So is there anyone who would like to take the first stab at a 1-minute response? All right, go for it.
Oh, okay. I thought I could also ask
Or you
questions.
can ask questions. You can
I
ask
just had a
questions.
question for the Green candidate. What you read sounded great. I did quite a bit of research ahead of time for this debate, and I didn't see that in print. Where is that available? Well, I went through the current Green platform, and there's only one sentence in the entire document, in a large paragraph just about the future, that addresses healthcare. There was no itemized budget items. I couldn't find any healthcare platform whatsoever. So I really like what you said. I just don't know if that's your idea or if it's the party's idea.
No, the Green Party has numerous different policy documents, and we have an over 150-page document called Vision Green with quite a lot on healthcare. And if you went to Vision Green, you would find a lot there.
So that's its own site?
It's accessible through the Green Party site, but it's difficult to get hold of. I agree. It's
Okay,
not
I have to say that if we're going into an election, I'm a candidate. I just joined the party a few months ago myself. I'm new into politics. But if I'm going to trust folks ahead of me and what they're promising, I'd like to see that really clearly.
Right, well it's in Vision Green. It may not all be on the original platform, which is quite a small document, but Vision Green is a much more detailed document. We do deal with things like that. We also deal with issues of physician shortages, etc. And
I just think that what we're saying is we love what you said, so post it on your website because people want to be able to read.
Most people do love what the Greens say. And that's okay. We come up with these ideas and we're quite happy if you use them. We're not sort of...
But it also wasn't one of the things, I mean, the Green Party's also been promoting that you've costed all your items, and it's not a part of the costing that's online.
Well, what I was mentioning was more efficient use of healthcare, not forever saying all you need to do is put more money into it. I'm saying evidence-based medicine needs to be practiced universally. That's not going to be a big taxpayer outlet. That's a decision that needs to be taken by us and by all physicians and by care providers. That can be taken without a whole lot of costing, and is probably, like a lot of Green suggestions, a cost saving. The same thing with making safety culture essential, a central tenet of all healthcare. If you bring in a safety culture, you will save money. So I'm saying, don't just throw money at healthcare. We know throwing money at healthcare is not necessarily a solution.
And I'd like to know from the NDP that you have said you're going to hire more doctors and nurses. I guess I'd like to know how you are going to do that when there are these things called provinces, and you can't just go hire them. I mean, obviously they have to actually be trained, and how. So how does
the
that
word
actually,
training does appear actually as well.
So I mean, how does
We
it
don't
work?
just go and
So,
find somebody.
no, but without primary care reform and without people sort of having a look at really who's the best person to do each part of the team, that sometimes it's nutritionists and social workers and, you know, I think in my practice I looked after about 2,000 patients.
Can I answer
I
your
think
question?
if I'd had a social worker and a nutritionist and I could have actually looked after 4,000 patients.
Yep.
So how exactly are you going to get these, where are you going to get these extra doctors and nurses? When would they be in place? How much will it cost? And how are you going to deal with the provinces?
Dr. Ben, you know the answer to that question, but I'll say it for the audience. So we have, this is the next question though.
You should be running for Conservatives.
Actually, for the Conservatives, hardly.
I like to come up with consensus in these debates, not bash one another.
Sorry.
Okay, well, we can be nice, and I'll agree that we all have great ideas.